Hello. Today we'll be talking on nursing process. Nursing process. And we'll be dealing on question 61 to 80, all on nursing process. So what is nursing process? Nursing process is a framework that is made up of 5 steps. The acronym for that 5 step is ADPIE. ADPIE. So this framework is used to deliver holistic and patient-centered care to all patients that come in contact with the nurse or the nurse is caring for. So nursing process is a framework that uses this individualized, holistic and patient-centered care to care for each patient. So what are the 5 steps in nursing process? I say the acronym is ADPIE, that's ADPIE. A is assessments. When they say assessment is you observing the patient and patient telling you what is wrong with them. And in that assessment, where you do your observation and patients give you their own complaint, they call it collection of data. Data is information, and the data could be subjective or objective. Subjective data are data that the patients themselves tell you. It could be primary or secondary. Primary is the complaint or the data that the patient that is sick gives to you. But when you collect patients for maybe neighbors or relatives that came with that patient in cases where the patient is unconscious, that is secondary data. Then the data that the nurse herself or himself collects through vital signs, through observation, etc. is called objective data. So subjective data and objective data, they are under assessment. After assessment, the next thing you do is to diagnose these patients. Nursing diagnosis is different from medical diagnosis. Nursing diagnosis, you must relate that disease condition to a symptom or to a sign or to a complaint. You must relate it. That's why you always say pain related to this, person integrity related to this. You must relate it. That is nursing diagnosis. After diagnosing this patient, the next thing you do is plan. You must plan based on your diagnosis how you are going to care for this patient so this patient can be better. So that next one, the P is planning. After planning, you will now implement. Implementation is the action plan. You implement by giving the different interventions that you need to give to these patients. After giving this intervention, you must evaluate to know if your goal has been achieved, if your objectives has been achieved. So that is nursing process. So we start with question 61 now. Question 61 says, the nursing process is best described as the answer is A. It's a systematic method of providing individualized nursing care, holistic nursing care, patient-centered nursing care. So whenever you see this systematic method or way of providing individualized care, or they will say holistic care, or they will say patient-centered care, that is nursing process. Question 62. The first step of nursing process is what? Is A. ADPIE. A. Assessments. Assessment. So put that acronym in your head. ADPIE. So the first step is A. Assessments. And under your options, assessment is B. So B is the first step. Second step is diagnosis. Third step, planning. Fourth step, implementation. Fifth step, evaluation. So your answer to this question is B, assessments. Question 63. They said during assessment, the nurse primarily does what? What does she do? You collect data. During assessment, like I said, you must collect data, you must collect information. So collect and organize patient's data. That is what you do during assessment. After collecting this data, you organize this data. That's when you now use this data to diagnose this patient. After diagnosing, you now plan how you care for this patient. So assessment is collection and organization of data. 64, which is an example of subjective data. Subjective, from the subjects, the patients themselves. What is the information that this patient gave to you? What is their complaint? A say temperature. Temperature is the patient cannot check their temperature themselves. It means it's objective. Blood pressure, objective, because the nurse is the one checking it. D says respiratory rate. It is the nurse that is checking it. So they are all objective. Except C, patient complaint. Anything that the patient tells you is wrong with them is subjective data. The one you check yourself as the nurse is objective data. So your answer is C. Question 65. Which is an example of objective data? Patient says, I'm feeling dizzy. Patient report of nausea. Patient says that the wound is painful. Anything patient says is subjective. So the only thing that is objective in this option is not observed pallor. You can observe pallor, you can observe cyanosis, you can observe patients, maybe the grimians, etc. Whatever you observe as a nurse is objective. So C is your answer, objective data. Number 66. A nurse diagnosis differs from medical diagnosis because it focuses on what? It does not just focus on the patient's, let's say the patient's immediate need. It also it wants to see the response that this patient will give when you actually put in your interventions, etc. So they say the patient's response to actual or potential health problem. For example, if the patient is having pain, the nurse wants to see, after giving pain relief or after telling this patient to change position or giving cold compress, etc., what will happen to that pain? Will it reduce or will it increase, etc.? So that is why nursing diagnosis is actually different from medical diagnosis, because the patient's response to actual or potential pain is very important to the nurse. So that's nursing diagnosis is different from medical diagnosis. Nursing diagnosis, now you say pain related to, it could be inflammatory process, it could be to injury, it could be to etc. But medical diagnosis, they can just put RTA because it's road traffic accident. They just say road traffic accident. But as a nurse, you know that it's not just road traffic accident, this patient is in pain. So I'm using that pain as my own diagnosis. So that's the difference between nursing diagnosis and medical diagnosis. Number 67. Which statement is written as a nursing diagnosis? Pneumonia, malaria, hypertension, those ones are normal diagnoses. Those ones are medical diagnosis. B is nursing diagnosis because it's a impaired skin integrity related to prolonged pressure. Like I said, nursing diagnosis, you must relate it, is a must. You must relate it. That's even how you write it in your nursing care plan. So you must do related to, evidenced by, etc. So the statement written as nursing diagnosis here is B, impaired skin integrity related to. They must be related to. Number 68. After identifying nursing diagnosis, the next major step is what? Third thing. After diagnosis, what is next? Planning. After planning, intervention or implementation. After implementation, evaluation. Once you know these 5 and each step, how they go, you'll be able to answer almost all questions concerning nursing process. So the next step after diagnosis is what? P. ADP, planning. So please, ADPIE, add ADPI. So after diagnosis, D, the next one is P, planning. So your answer is A. A is your answer. 69. A well-written nursing goal should be, the nursing goal is like nursing objective. After your diagnosis, you do objective before you do intervention, rationale, and your evaluation when you are writing out your nursing care plan. So after your diagnosis, the next thing you write, what is your goal? What is your objective? Goal there is objective. So the nursing, well-written nursing objective should be B. It should be measurable and it should be patient-centered. Measurable, patient-centered, it must be realistic, it must be timely. They call it SMART. SMART. Your goal, your objective must be SMART. SMART. It must be SMART. SMART means S is, it must be specific. It must be specific. Then M, it must be measurable. A, it must be attainable or achievable. R, it must be real or realistic. Then T, it must be timely. That is SMART. SMART. Your goal and your objective must be SMART. So it must be measurable and it must be patient-centered. Number 70, say which part of a nursing care plan states what the patient is expected to achieve. What the patient is expected to achieve. That's your nursing objective, your nursing goal, your expected outcome or potential outcome. The outcome will now be your evaluation. So the answer to this question is B, expected outcome. Like what you are expecting. Expected outcome, your objective, your goal. That is what the patient wants to achieve. Say what part of nursing care plan states what the patient is expected to achieve. So your expected outcome, or you say the objective or the goal. That is what states patient's achievements in nursing care plan, which is the second column on your nursing care plan. That's the nursing objective. Number 71. What outcome is most measurable? When they say measurable, it means something that you can actually measure, like your temperature, you can measure pulse, respiration, blood pressure. You can measure them. So what they say is that what outcome is most measurable. If you read all these ones now, patients feeling better, we improve, patient's comfort, that one you can range it with scale. You see a scale of 1 to 10, the patient will not grade it or you will grade it. Or something that is measurable, your respiratory rates or your vitals, they are all measurable. So in this question, the answer is C. Respiratory rates is most measurable amongst the options listed here. Number 72. Implementation in the nursing process refers to what? Your implementation. I told you implementation is the action plan. That is when you carry out everything that you've planned to reduce this patient's suffering. So putting plan, nursing intervention into action. Anywhere you see action is intervention. Is the intervention or implementation. In your nursing care plan, they will say nursing intervention is actually still the same thing as nursing implementation. It's still the same thing. Nursing action. So they are the same thing. Nursing action, nursing implementation, nursing intervention. They are all what the nurse is doing actively to help the patient. So your answer is A. Putting all your plans into action is implementation. Number 73. He said, which activity is an independent nursing intervention? When they say independent, it means the doctor don't have to prescribe it for you to do. It's like a normal thing for you to do. Doctor can prescribe vitals. He can say do these vitals every 2 hours, do it every 1 hour, every 30 minutes. But there are some nursing duties or nursing responsibilities that you do not need any prescription for. Example B, changing a patient's position. You know, as a nurse, a patient that is bedridden or unconscious, etc., you need to change the position within 2 to 3 hours. You don't need anybody to tell you that. You don't even need it to be written on the patient's case note. That is an independent nursing intervention. When a patient is catching cold, you don't need anybody to tell you to give the patient a blanket. If the patient is very hot, you don't need somebody to tell you to open the windows, etc. So those are independent things that the nurses carry out on her own without prescription by the doctor or any other person. So the options here, if you want to do X-ray, they will prescribe, analgesic, they will prescribe, antibiotics, they will prescribe. They'll write it on patient's case note. But changing a patient's position is an independent nursing intervention. Number 74. They say evaluation involves determining what? What does evaluation, what does it involve? They say A, say the patient has been admitted. B, the planned outcome has been achieved. C, the nurse has completed documentation only. D, the physician has reviewed the charts. It's B, your outcome has been achieved. Sometimes it's not after evaluation, you can evaluate and then you've not achieved your goal. But if you evaluate and your goal has not been achieved, you go back. let's say patient is having high temperature. Then after tepizpogen, giving of drugs, etc., you now evaluated that you rechecked again and the temperature is still same or even higher. You now have to go back again to do another diagnosis and plan more for this patient. So evaluation means whatever you planned, your expected outcome has been achieved, you've done it. That is evaluation. So you evaluate if what you wrote under your objective, if it has been achieved or not. That is evaluation. 75 said if a patient's goal has not been achieved, the nurse should first, what should you do? Your goal has not been achieved, just like what I just said now. What should you say? Reassess the patient and review the care plan. You must go back again and review it to see maybe you missed one or two things or how you can improve that care plan. So reassess the patient and review the care plan when your goal was not achieved or you've not achieved your goal. So that is what you should do. Like I said, if the temperature is high and then you checked it after intervention, after tepizpogen, etc., you checked it's still high or it remains the same, you have to go and reassess this patient and review your care plan. So that is what the nurse should do. 76. Which source is considered primary when collecting subjective data? When I started, I said subjective data could be primary, could be secondary. Primary is from the patients. Secondary is from maybe relation or their neighbor. Somebody that came with them, that knows this patient. That is primary. Primary is the patient. Secondary is patient relative, patient neighbor, etc. That's the secondary. So they said, what source is considered primary? Not just primary subjective. So the patients themselves is subjective data and it's also primary subjective data. Secondary is the patient, the neighbor, medical file, another patient. They are all secondary because they are not the patients. You understand? They are all they are not the main victim. They will only tell you what the patient told them. But primary source is from the direct source, from the person that is affected. That's primary subjective data. 77. A nursing care plan should be what? D. It should be individualized. Each patient have their own care plan because each patient's signs and symptoms are different. Their problems are different. Their sufferings are different. It must be updated as the patient's condition changes. You must update it. If you did the pain in the morning, in the afternoon, patient is no longer feeling pain, your nursing care plan should change. You should update it that patient is no longer feeling pain, so that pain should go. You now redo your diagnosis again. By assessing the patient again, you now do a new diagnosis that you will now use for the new or fresh care plan. You must update this patient's condition. If you don't update it and then you hand it over to the next nurse, the next nurse may think that this patient is still in pain. Meanwhile, the patient is no longer in pain. So you must update your patient's changes on their nursing care plan. 78. Which documentation entry is most appropriate? Which documentation entry is most appropriate? Patient seems okay. Patient is fine. Patient ambulated 20 meters with assistance and reported dizziness. D. Patient had a bad day. Which documentation entry is most appropriate? By seeing just this ABCD alone, you know it's C. But for example, let's say this other A, B, and D are kind of similar with this C. The reason why the C will be most appropriate is because of this dizziness. Because of the dizziness there. Patient ambulated means patient walk around. They can just say patient walk around about 20 minutes and patient is okay, no complaint. Patient could not walk as a result of maybe patient says she's tired, etc. Or patient just had a bad day because a patient relative came that they don't like, they quarreled, etc. Because of this dizziness, this one will be most appropriate for you to document or for you to report, because this dizziness could be as a result of many health problems. So documentation is as a result of what will be important for this patient that the doctor they need to know, so that they can reassess this patient and check if there are other underlying problems that they missed. 79. The nursing process is commonly remembered using the acronym ADPIE. The letter P represents what? P, planning. A, assessment. D, diagnosis. I, implementation. E, evaluation. 80. The major purpose of the nursing process is what? It's just like the importance of the nursing process. A, to provide organized, individualized, evidence-based, holistic, patient-centered care. Nursing process is not a big deal if you can understand the reason behind it and how it's done. Even nursing diagnoses, they are not a big deal. It's something you learn, and over time, you know it. So follow us for more videos. Thank you.